My name is Sarah Leible, and I'm in Team 3, and we focus our project on trauma-informed care at the Family Care Health Centers. This is a clinic that provides comprehensive medical care to people of all ages and has two locations, one in Holly Hills and one in the Grove. Trauma-informed care acknowledges a person's trauma in their life and realizes its neurological, physical, emotional, and cognitive effects it has on their life. As a result of this trauma and the stress that comes along with it, our bodies go into a fight, flight, or freeze response. In this response, we decide how to act so that we can survive. In turn, it affects things like heart rate, blood flow, memory formation, and blood sugar. As it was researched in the Adverse Childhood Experience study, otherwise known as the ACE study, these traumatic events result in long-term disease such as diabetes, heart disease, and some types of cancer, also chronic social problems like depression, alcoholism, and drug abuse, and ultimately early death. Hence, this is an important topic that we need to address in the healthcare because it directly affects people's health. According to the ACE study, more than 50% of the general population has experienced at least one traumatic event, and more than 25% have experienced two or more. So it's clear that it's happening in all areas across various social, economic, and ethnic backgrounds. The Family Care Health Centers are beginning to learn more about trauma-informed care and how to better acknowledge their patients' trauma. To form a foundation for their improvement, we created a survey for the two different locations. In the survey, we asked what makes the patient feel comfortable and safe in their clinic environment, if they feel anxious or scared when going to the clinic, if any part of their healthcare exam makes them feel uncomfortable, if they trust their healthcare provider, if they leave their doctor's visit feeling confused, and if they believe their healthcare provider has their best interest in mind. We think this will give them great information to start building ways to improve their environment so it's more conducive for people that have experienced trauma. Although we can't really see the direct impact we're creating in this environment, this aims to improve the health of the population because we laid a foundation for all the faculty and staff there so they can start making changes to their environment and care so people have more positive experiences while they receive care there. I was able to visit both sites to hand out the surveys to the patients. I really enjoyed getting to interact with the patients and seeing the results from the survey. I think I can use all of this information from our project in my day-to-day interactions and not be so quick to judgment when someone is not acting or behaving in a way that I think is appropriate. In my professional life, I can keep this information in the back of my mind as I encounter patients from all sorts of backgrounds and learn to ask the right questions so that I'm more sensitive to any type of trauma that they might have been through. I think overall this information will help me be more patient, have more patience, and respect for others because we all have our story and our own unique experiences that have shaped us into the people we are today.